Can you actually describe to us, maybe in layman terms, without too much detail that
Sure.
will gross us out, but what parts are removed and replaced with the implant?
Sure. So when you are having a knee replacement surgery, the damaged portion is really just the end of the bone. So the knee is made up of two main bones, the femur, or the thigh bone, the tibia, or the shin bone, and they come together forming a hinge joint. The part that's damaged is the ends of those places. Well, another word for it, the articular surface, or the parts that are actually hitting each other. So when those are damaged, we replace just the ends of those bones. So most people have had some type of dental procedure where maybe they've gotten a tooth capped. It's similar. It's capping the bone with a metal implant that creates a nice smooth surface that can replicate that smooth movement of the knee you were born with. In the hip replacement procedure, it's similar. The hip is a different type of joint. It's a ball and socket joint, and the damage around the hip usually involves both of those things. So when you had a nice round ball moving in a nice smooth socket, you've got great motion, no pain. So what we do is replicate that by removing that damaged ball and recreating that smooth socket with metal, ceramic, and plastic implants.